And then we will show 5-minute sign in between when the 5 minutes are remaining. And after that, we have only one presenter for this session, Dr. Nasreen Shah. And then we will have, and then we will have the discussant or the audience, if you have any question, then we will do that. And regarding, please try to stay mute on your mic as in case if there is, to avoid the disruption in between. And yeah, that's that. So, and then let's quickly look at the sponsors that are generous enough to sponsor our Muslim mental health presentation, a conference.
Assalamu alaikum, everyone. Welcome back from our lunch break. And so I'd like to introduce our next speaker, Dr. Nasreen Shah. Dr. Nasreen Shah is a clinical psychologist and co-founder of Shah Psychological Services. Dr. Shah's approach to treatment incorporates research and identity work with acceptance and commitment therapy, serving adult outpatient populations in Eastern Washington. She's also an instructor at Eastern Washington University, teaching courses in psychology, including Muslim mental health. Thank you, Dr. Shah, for being with us today. Would you like to share your screen?
Yeah, thank you for having me. Let's see if I can do this correctly. It says host disabled participant screen sharing.
Oh, I'm gonna just make you a co-host and then you'll be able to. Okay, try it now.
Okay. Okay. Ooh, let me make this bigger. Can you see just the presentation?
Yes. Yep, and we can also see here in the audience.
Am I supposed to, when a button, this says admit, is this someone entering? Do I click admit?
Yeah, it's okay. I have that covered, so don't worry about that. Yep.
Oh, perfect. Okay. All right. Well, I will go ahead and get started then. Thank you for the introduction and for having me here today. I'm a little bit lucky in the sense that some things got switched around, so we have a little bit more time today to discuss this. So this is incorporating Islamic principles into therapy. Let me find my button. There we go. Okay. So these are the main concepts that we will be covering, and specifically what I want to discuss with you all is how many of our, these are individualist theories of mental health and approaches to counseling. And I want to discuss with you how we can bridge those theories with collectivist cultures, that if we can educate and broaden the ability of the therapist, they can work from their Western therapy modalities in a way that is effective with Muslim clients and other collectivist cultures. This presentation is from the chapters I authored in this recent publication towards a positive psychology of Islam and Muslims, and this textbook is available from Springer International. Okay, so a little background for us. So early Islamic scholars were actively engaged with the treatment of the mind and body. And one of the most famous early scholars, al-Balkhi, proposed concepts such as the impact of cognitions, mental health diagnoses, and the importance of caring for the soul and the mind, so that mind-body connection is present in treatment. And we should note that all of this was taking place in the 8th and 9th century at a time where Europe was in its dark ages, and that was not so for the Muslim world. Al-Balkhi's writings are very similar to modern day cognitive therapy approaches, and he is believed to have been the first to discover and diagnose mental health illness as having psychological and physiological causes. So from this, we come to understand that Western and Islamic practices to healthcare are not separate, but rather are very connected in history and experienced. Al-Balkhi categorized 4 types of emotional disorders: fear and anxiety, anger and aggression, sadness and depression, and obsessions. And these are very much in line with the diagnostic categories that we have in our current DSM. So one approach that we are going to talk about today is acceptance and commitment therapy. Acceptance and commitment therapy is a third wave cognitive behavioral therapy, meaning it stems from CBT and is a modern approach at mental health treatment from the family of cognitive behavioral therapy. In my clinical practice, I operate from acceptance and commitment therapy and have seen really strong implications of this therapy modality with both Muslim and non-Muslim clients alike. So that's what I'm excited to get to promote and hopefully share things with you that are going to be helpful in your practice as well. So what brings Muslim clients to therapy? So many things can bring Muslim clients to therapy that are similar to any person seeking therapy, but especially things like relationships, career, phase of life issues, anxiety, depression, and other mental health concerns. So this could be similar to any client attending therapy, but one thing that's really important in providing services to Muslim clients is also being able to work in the area of identity work. So one of the key areas of focus is that we have to incorporate all aspects of a person's identity in order to effectively engage in treatment. Now, in predominantly white areas, scholarship and clinical work are homogenous. Okay, so we're not having discussions about working with diverse populations. We're not talking about, the myriad of other therapies and interventions, and we're not talking about things like, is this person, what is their history or their story? How might it be different if a person is first gen or second gen, recently immigrated? What is their culture or multiple cultures, which is very, much the identity or makeup of the Muslim population is that it's diverse. We can't even just say like what brings Muslims into therapy without going deeper and looking at the culture and the background of that person. So many of the practitioners that I work with know very little about identity work, even the basics of someone's culture and religion. And then that presents a huge barrier in providing effective treatment. So this is really important area of focus for me is how can we bridge Western and Islamic practices as opposed to the current assumption that mental health providers have, which is that this is divided or separate. I don't know about, Muslim clients or that population, so I can't work with them. That's not true. So in regards to identity, the various subcultures within the population of Muslims here, I am primarily focusing this presentation on the application of acceptance and commitment therapy to Muslim Americans, majority being second generation or later. And this group being at the forefront of seeking services and being unique in that they hold more than one cultural identity. Okay, so what we must ask ourselves as providers is, what is the lens through which the therapist sees the world? So their own identity, values, motives, and what are their goals for therapy? Western-based therapies train the therapist with the goal of separation and prioritizing individual needs of the client, not only as the marker of health, but also as the primary focus of treatment. Therapists are untrained in how to work within family and relational frames, how to uphold the client's values when they differ from the therapist, and this can lead to judgment. It can lead to pathologizing of culture, and that ultimately creates barriers for Muslim clients in wanting to access treatment, and it creates a lot of difficulty in trusting the therapist, so trust between the client and therapist. Therapists lack basic knowledge of so weird meaning Western educated, industrialized, rich democratic populations. This is the majority of where our research is done in psychology, meaning on predominantly white populations. So anybody or any aspect of treatment that falls outside of that lens is really hard for Western therapists, and it creates a situation where the therapist is not prepared or informed enough to be working with clients, and sometimes they're unaware that they're not educated enough and maybe shouldn't be working with that client. So they're in this window of they don't know what they don't know. And as a result, a common approach with Western therapists working with non-Muslim clients is that they'll ignore culture and religious identity altogether in treatment. So I hear this all the time, that Western therapies are not applicable to Muslim clients or others from collectivist cultures. And my goal today is to show you that this is simply not the case. Rather, certain therapy modalities can be very compatible with Islamic psychology. And being able to offer effective treatment depends upon two components: educating the clinician in Islamic culture and psychology, and combining the correct therapeutic modalities to work with this population, such as ACT and CBT, and recognizing elements in DBT as well, which we'll talk about today. Okay, so I want to first highlight for you these practices that overlap talk therapy and Islamic principles. So use of language and relationship with the rules of language is really predominant in ACT as well as THUSB. So these language-oriented frames that build our relationship with Allah, that can build our foundation for mindfulness and mental health, are also really present in ACT. ACT emphasizes a lot of what we say and how we say it, because this creates the lens through which the person views the world and engages then in certain behaviors. And THUSB is also a language-oriented practice. Okay, so recitation that we have, pronunciation, translation of meanings are used in Islam to foster growth and observation of mental processes. And the same can be done and is done in ACT with thoughts and emotions and behaviors. Poetry is commonly used in dialectical behavioral therapy, especially radically open dialectical behavioral therapy, which is a form of treatment for people with disorders of over-control. So obsessive compulsive disorder, personality disorder, folks who are really in distress due to their rigidity. The treatment manual uses Rumi's poetry as a means to expand cognitive flexibility and to teach folks to process their experience from the broader lens of things about life, things that are outside of their control. So this is really interesting. This use of Eastern philosophy and practices are common in Western psychotherapy, primarily because they address the concept of the realm of life that is out of one's control. Western psychology and Western culture relies heavily on everything being about the individual, including suffering, and they don't have much of a concept for things that are out of a person's control. both the acceptance and the understanding of that. But we do in Islamic psychology, which is why, as we'll see in a moment, ACT is so powerful as it addresses the concept of what happens to us or how do we cope with things that are out of our control. We have that framework in Islamic psychology and in Eastern practices, which is why I think you see Western practices also borrow from our modality, because that is where they fall short. Dialectical behavioral therapy, here's another example. So this is a form of therapy that is used for folks in crisis, meaning these folks need a higher level of care. So these might be folks who are struggling with suicidality, eating disorders, self-harm, substance use, things that are chronic in nature and require a higher level of intervention. So instead of just 1 week, 1 session of therapy per week, these folks are also engaging in group. They're engaging with other meetings with their therapists. So some of the principles that we see in DBT, for example, like the mammalian dive reflex, when a person is experiencing a panic attack, you work with their physiology. This is where you take a bowl of ice water and submerge the face up to the temples, and you want to bend because that engages that vagus nerve. And really quickly, what it will do is drop the person's blood pressure, which actually kind of overrides the sensation of panic, right? And we see certain things that were taught in DBT that are also taught in Islamic practices. So the Quran and the Hadith give similarly compatible advice. For example, when we engage in wudu, when we're told that if we're experiencing anger, we should change our position, sit down or lie down. When we feel anger, why? Well, because it works with our physiology. When we feel anger, our body physically tenses. We're like this. We are literally ready to fight or flight. We're in that mode, and the person will physically even move forward and tense their limbs, almost as if they're ready to defend, because that's what the body is doing. It's cued for activation. But if we change our position, if we sit down, if we lie down, if we move back and relax the shoulders, this sends a different signal to the brain. Right? So we have this in DBT, but we also have had this for longer than DBT has been around in our Islamic practices, that changing our body position cues our brain to slow down and deactivate that arousal. So these are examples of forms of intervention and therapy that are compatible with Islamic practices. Now we get into acceptance and commitment therapy. So in ACT, this graphic right here, the hexaflex, has 6 domains that represent ways to engage or increase a person's psychological flexibility. Psychological flexibility helps the person improve their mental health by helping us to be open to making new choices moment to moment, depending on what the situation calls for. And we're going to go through each of these. Okay. First, the principle of acceptance. So acceptance means acknowledging the situation and engaging with it in a way that is reflective of our values, as opposed to remaining stuck in suffering. Acceptance is a core characteristic of Islamic psychology as well, and we can see this in the principle of sabr, the patient part being acceptance of the situation, and the active engagement part of sabr, meaning we continue to work towards our goals and show up in life in meaningful ways. We continue to do what matters spiritually and physically to navigate a hardship. So acceptance behaviors look like, I didn't choose to lose my job, but I am going to seek support from my loved ones. I'm going to actively engage in working to find a new job, while I also equally actively engage in prayer, in dhikr, and I'm going to look at ways to frame this in a way that is healthy for me mentally, physically, and spiritually. So how is that different than non-acceptance? When a person is in a state of non-acceptance, or what ACT calls inflexibility, what they're doing instead to cope is that they're struggling for control of a situation, which often leaves the person stuck. So when you're unable to control something, such as losing your job, non-acceptance behaviors look like avoidance, sleeping all day, drinking to cope, not taking care of yourself, withdrawing from social support. It also looks like a lot of negative dialogue. So this person might be internalizing this situation, especially for people with a Western-based lens or American culture. You might hear a lot of the person internalizing their failure, that it means something about them, as opposed to acknowledging that some parts of our situation are due to factors that are outside of our control. And eventually the person becomes more defeated when they can't control the situation. Well, what happens? We get tired, we get stuck. Avoidance behaviors make the problem worse, and naturally our mental health symptoms are going to increase. So acceptance in ACT is also the acknowledgement of factors outside of our control. So ACT says some parts of what happens to us is decreed by the universe. Something was given or taken from us, and that is, ACT acknowledges that part of the things that are outside of our control. In Islam, we also have words like the ghaib, the belief in the unseen, the belief in parts of our destiny that we don't know about, the belief that there may be things that are good for us that we don't know about, or that are harmful for us that we're protected from, that we don't have full knowledge of. So in ACT, we say some principles acknowledge that part of suffering is to be human, that we go through tests and hardships in life. We didn't ask for it, but even so, here it is. And ACT gives people a way to look at their suffering by saying, you didn't choose the suffering, but you do get to choose how you want to respond to it. So how do you want to show up to this situation? That's acceptance. So acceptance does not mean going belly up. It doesn't mean defeat, but rather asking ourselves, now that the situation is here, how do I want to navigate the parts that are in my control, which is the choice that I have to show up to the suffering, not necessarily the suffering itself. So this brings us into cognitive diffusion. Cognitions are a key component in our mental health and influence our behaviors. We've long known that thoughts and behaviors are connected, right? So diffusion is the act of creating space between ourselves and our suffering. You'll notice in people that are suffering, they will use language such as, I'm depressed, or I can't do X, Y, and Z because of my depression. This is called fusion. So this means that we've fused so much to a problem that we've created an identity with it, so much so that we operate now through the lens of depression. So it's hard to see where, depression ends and the person begins. They're no longer separate. Right? So diffusion, how do we create space then between the person and their suffering so that they're not building an identity around this test or this hardship? Well, diffusion is practiced through language exercises that help the person create space between themselves and unhealthy thoughts. The very first way that we do this is by noticing and naming a thought. You have to pull them out of the person's mind, because when they're in here, they're operating and they're giving full control, and they're really at the cusp of the suffering that the person is going through. So the first thing we say, we pull the thought out and we form new language with it. So we say, I am noticing, I am aware of the thought. My mind is telling me that I am a failure because I lost my job. And then we explore and we expand upon that thought. Is that thought helpful? What else is behind that thought? What else is part of that truth? How do I want to act on this thought? Now, Islamically, there are many ways that language shows up that builds the cognitions of a Muslim's thinking and regular speech. So we have examples of thought processes that create diffusion by acknowledging the role and decree of Allah in a person's life. For example, when someone dies, the statements that we repeat a lot, to him we belong and to him we return, that is an example of that remembrance of the part of life that is certain and that is outside of our control. Saying inshallah, so bringing about God's will or intention before we do something, or when we set out to do something, reminds us, I have my action, I have to show up 100%, and I have to trust and acknowledge the factors that are with Allah or that are out of my control. Starting our day with intentions such as Bismillah, in the name of Allah. These are all examples of language practices in Islam that guide the thinking of the Muslim. Why is this foundational to mental health? Because when we don't have this, in the absence of the acknowledgement of Allah's will and of understanding and making meaning of hardships, the idea of accepting that hardship is a part of one's life, we go into despair. So people from a cultural lens then view it as, no, I'm suffering because I'm a failure and it's never going to get better and there's nothing I can do. And then they really become hopeless without this broader lens. And the broader lens is built upon the language that we use that is connected to our thoughts and behaviors. The other purpose of language is that it brings us to the present moment, and it reminds the person of the role of the unseen in their lives, right? That God is an outcome, it's a factor in a person's life, and that God is ever present and all-knowing. So if steeped in depression, for example, part of the diffusion of thoughts occurs in acknowledging and working from a perspective that accepts that suffering is part of one's life, as opposed to, something that you became. You're not defined by your depression. You don't even have full control over your suffering. But by acknowledging God's role in one's life, it also means you're not alone in your suffering. And we know from the research that this has really big positive impacts on people's mental health. So let's go look further at the rest of these principles. So in this part of the hexaflex, now we've acknowledged that we didn't choose our suffering, but we do have a choice in how we respond in our lives moment to moment. So willingness asks, what are you willing to do to build a meaningful life? Are you willing, for example, to be anxious and endure conflict by having an awkward conversation with a loved one if it means it will move you in the direction of a better relationship with that person, move you in the direction of your values? That's what willingness asks. Are you willing to tolerate some level of distress or sacrifice if it means you can expand your life and engage in valued living? This ties into committed action. So even though we didn't ask for suffering, we are still responsible for keeping ourselves healthy. So that doesn't mean that we don't feel the impact of suffering. What it means is that we don't go belly up and let ourselves drown in a problem. Each day we make small choices that help us cope and stay healthy to navigate the hardship that we're facing. So it reminds us not to get stuck in helplessness. And that moment to moment, we always have a choice and we always have an impact on ourselves and others. Now, a common exercise for committed action and values in ACT is to ask who your heroes are and engage in life in the way that that person would. So in Islam, you might look at, like we do, and we commonly do this as a practice in the Hadith. We have the examples of the Prophet Muhammad sallallahu alaihi wasallam, as an example of how to live a rich and meaningful life, how to solve problems, how to navigate hardship. So we might look to this as an example so that we can kind of have a roadmap for our own behaviors or how we want to show up in life, right? So we have a rich tradition then that we can build upon in treatment by incorporating the Hadith and the Sunnah. So ACT is very compatible with Islam. Willingness combined with committed action can be seen in the lifestyle of a Muslim when we engage in fasting or daily prayers. So the person is saying, I am willing to tolerate distress, hunger, missed sleep when you get up for Fajr, and I'm willing to sacrifice my time and my interests to engage in the behavior of prayer and fasting because it moves me closer to my relationship with Allah, which is something that I value, right? So we didn't remove the hardship. It never is going to feel good to be hungry, right? We didn't remove the hardship there, but we said I'm willing to tolerate some level of distress if it means I can act in accordance with something that I value. Okay. So one of the key differences too between ACT as a third wave behavioral therapy and CBT is that CBT puts the person in this situation of needing to control their thoughts a lot. But in ACT, we acknowledge that, what if you can't control a thought? What if you struggle and this is like there's negative thoughts or rumination that come up again and again and again? The key difference here is that you can have difficult thoughts. You can't really control how you feel day to day or what shows up in your mind, but you always have a choice on what you act upon. And you always have a choice of buying into that thought. So when we pull the thought out, when we explore it and expand upon it, we can reflect upon our thought and we can ask ourselves, is this me? Is this indicative of my values? And do I want to act on it or not? So this can help us show up in ways that are meaningful, right? So if, for example, if we value kindness, can you be kind even when others are not reciprocating? Or when you feel really sad, can you attend an event for someone else so that you're upholding that value of the relationship, even if being at that event is hard for you? Can you pray even when you're tired or it's inconvenient or uncomfortable to do so? So what we say to ourselves creates a narrative down this path. So language helps with each of these components, and we're not removing the hardship. That's the key thing, is that we're teaching the person that they can engage in behaviors even when that negative thought is there, even when their mind tells them not to do so. Present moment awareness is really interesting in ACT in that we talked about daily prayers. This is really interesting. When a person breaks away from what they're doing in the moment, engaging in work or with family, or we're going about our daily lives, and we break away from what we're doing to adhere to the daily prayers, this is diffusion as a behavioral strategy. So stopping what you're doing to pray creates space between your engagement in whatever is happening in that moment, and thereby reinforces this idea behaviorally to the person that your day-to-day life is not all of who you are. It's not even the most important thing for you. And in doing so, when life throws the Muslim hardships, prayer is a consistent reminder to help stay slightly detached from what is happening to them in their life, right? So it helps the person build an identity that is not just dictated by what tests and hardships dunya throws at them, but build a life that is rooted in connection, that is consistent or more lasting than our limited lives or the limited scope of the problem at the present moment. Self as context. So this is a deeper component. And what this is that it teaches the person in therapy, we teach the person that there's also always a you that is observing and choosing even as you are experiencing life. So the part of you that we say in ACT is not just the pieces on the board of chess, like the pieces playing a game, but that you are the board itself. So you are a context remove from what is happening to you in your life, and you are greater than being a pawn in the game of life. So too with daily prayers, Muslims are reminded that there's more to their existence and identity than being a pawn in the world or the suffering that they're experiencing at the moment. So you can see how a therapeutic modality like ACT would have good implications for use with Muslim clients in therapy. You can also see the bridge between Western and Islamic psychology, that the principles of the hexaflex, and even the idea of ACT, the idea of acceptance was not created in ACT, but has been around for thousands of years from the Quran, from other Eastern philosophies, right? The idea that there's the divine or destiny or the universe, that there's things in life that happen that are out of our control, was not founded by ACT, but has been around for a long time. And the ACT has really taken these concepts of well-being and married them with Western approaches in therapy. So here we have, just to kind of put into an image for you the concepts that we discuss, that you can see the ACT principle and the corresponding Islamic value. So things like, for example, the Islamic principle recitation fosters observations of patterns of thought and use of language, helps with labeling unworkable behaviors. When we ask about willingness, that's a core component of building psychological flexibility. We have that principle Islamically through niyyah, or our intention. What do you intend to do? What are you willing to do? Because behavior first starts where? It starts in here. It starts with a thought. It starts with an intention. And Islam really acknowledges the importance of willingness as being connected to a behavior, which is really compatible with the orientation and act of what are you willing to do. One of the ways that you also might engage this with clients Islamically, if they're having a hard time thinking from themselves, is to ask the client, what do you think Allah wants for you in this? Or how does this fit with what you want for yourself? So you can start outward, you can start outside of the client and have them have a bigger scope, and then bring it down into how does this fit with what you're going through? How are these things connected to kind of help expand their thinking? So to kind of summarize here, we have, the main points that really well-being encompasses that mind, body, and the soul of a person. And that tradition of treating the mind, body, and soul comes from the Islamic tradition, comes from really the work of early scholars in the 9th century, where, Europe was going through their dark ages. We've long known this, and our well-being, our approaches to well-being have to focus on all of these components of the person. And this is in both Islamic and Western psychology. And much of our knowledge of mental health practices has been around for centuries. It didn't just start with Western psychology. And that therapeutic modalities, especially modern approaches like ACT, are very compatible to support wellness for Muslims and non-Muslim clients alike. So that concludes this presentation.
Thank you. Thank you, Dr. Shah.
Yeah.
That was an excellent presentation, and I'm going to open up the floor to some questions. If there's anyone who would like to put the question in the chat, or you can unmute yourself and also just ask directly, this would be a great time to do that. Or if you'd just like to even say a comment, share a comment, your takeaways from the presentation, some happy emojis, just interact. Well, actually, I have a question for you, Dr. Shah. I would like to ask, what are your, oh, there's a comment from Miyu King.
Oh, thank you.
Yeah, that was excellent. I agree. Thank you. So my question is, what would you say are your observations of clients who seek therapy with Islamic psychotherapy tools or Islamic psychology, but then they are struggling still, more than they thought they would, or they feel like they're not responding to that? What do you think has been the effect of on their religiosity through therapy, that they feel like, oh, I should be, I'm putting my faith in this Islamic psychotherapy or psychology, and it's not working right away, or they think it's maybe going to happen sooner than it is? What would you say has been the outcome on their religiosity?
Yeah, thank you. That's an excellent question, Sana. Let me make sure I'm understanding. You're saying, what happens if a person goes in for therapy and then and it has Islamic principles, but then they feel like they're not getting better? And you're saying, could that decrease their religiosity?
Yes.
That accurate?
Or make them feel like a failed Muslim or something, like a crisis of faith. I went to seek help with this particular background and it's not helping me. So what does that say about me as a Muslim?
Oh, wow. Yeah. Okay. Yeah, that's that'd be really huge. So, right. So that's talking about, we're internalizing. So those are a series of thoughts. I think what you're pointing out though is why I feel it's really important it's not just about having a Muslim clinician, but it's about what area they operate for. So those things do come up. Those are a series of thoughts, especially with someone who has depression. They are internalizing that. They think that a whole bunch of negative thoughts. So you have to be able, so for me, I can work there and go there. So for example, it's that is a series of thoughts, and we're going to expand that thought. So you're internalizing that you feel like a failure because you don't feel better. Let's look at what that means and what's holding you back from that. So we would expand upon those thoughts, but you also have to be able to have the conversation So you feel like a failure is a thought. And so from ACT, we view thoughts and emotions as data. They're there to tell you what you're experiencing in the moment. So for me, and this is I'm telling you a nutshell, but it takes several sessions. I also preface with clients, like, you got to stick with it, and you're going to feel worse before you feel better, because we're going through really difficult things, right? But so I'm telling you in a nutshell, but keep in mind the context. What I'm about to tell you would take like several sessions to get the client to have their thought frame go this way. But what it is well, you feel like a failure because you're not feeling better. So you had some beliefs about how this would work. Let's fully expand that. Who, if you're feeling like you're a failure about something, or like your identity as a Muslim, then by that same train of thought, if we have to expand that thought, we can't look at it just only halfway. So there's more to that thought. So that's one slice of the pizza. The other slice of the pizza is you feeling like a failure also is indicative of, your iman and how much you care about your, relationship with Allah. You putting action into going into therapy, even though it's hard and difficult and doesn't feel good, is also engagement in valuing yourself, your acceptance, of things that are outside of your control, and your ability to engage in sabr, which is extremely, extremely difficult, to patiently pursue being healthy, even when it's hard, is also indicative of you valuing yourself and upholding your responsibility to take care of your health. So there's more to a thought than just the bubble it exists in, but it certainly takes a lot of time for this to come from the client, for their thoughts to become rewired like this. And what you're bringing up is really common, and it really, I think, takes, being able to have the full conversation and being able to know how to work with thoughts like that. I certainly don't see folks coming into therapy and feeling worse about their religiosity afterwards. If anything, it's like, once you change the relationship, once we reshape the relationship between a person and their thoughts, if anything, your religiosity usually gets better, because it's connected to all areas of your life. Your health improves. So now I'm not in that relationship of struggling. Failure is like, I'm struggling, and it's like, you don't need to struggle anymore. We expand that thought, and now it's not controlling you and your actions. So you can now engage in your deen a little bit better and show up in life better.
Yeah, actually, that does make sense to me. And then I'm thinking about your hexaflex model and how everything's connected. So would you say that's kind of like the emphasis on the therapist to kind of, would they try to transition or try to like do a different strategy or something that's maybe less religiosity based, more like Western psychotherapy based? Is that kind of what you were meaning by the hexaflex? So you can kind of go back and forth based on the needs of the client or the person seeking therapy? Or would you say, oh, it just takes, like you said, several sessions, let's stick to this way of doing it? Or would you, I'm not sure if I can if I can explain that question any more clearly, but
Are you asking if it's different how you use the hexaflex with Muslim and non-Muslim clients?
yes, like, would you be able to, based off the patient is like, oh, maybe getting anxious that like, oh, it's not working, this Islamic psychotherapy is not working, so then you kind of back away from the Islamic psychotherapy and kind of focus on, well, this is something that's used for this kind of like treatment modality universally. And then,
Oh, sure. Okay,
then,
so
yeah.
That depends on, so like I said, I'm not operating from, so the hexaflex in ACT, those are all the principles. And then I gave examples of it from an Islamic point of view, but I don't preface to know or connect with that on the client's end. So you go where their identity is. So if something's not hitting, like, let's say, especially if it's like religiosity is a big source of like difficulty or discomfort, they may not be praying. We're not going to be talking about prayer. I don't assume, I don't assume anything about religiosity at all. These are just ways that like this language or this mentality of this therapy is and can be compatible. Like, we have these concepts in Islam too. We have the concept of willingness in Islam too. So it's like you work within the frame of view of the client, but religious guilt it comes up all the time. So for me, so the examples that I would use, sometimes the language is different with my Muslim and non-Muslim clients.
Yes.
So
Yeah.
some, like, for example, with my Muslim clients, like, we can speak about like you know, like death and the unseen and the unknown, and how does that factor into what's going on with me in the greater scheme of my life. With a non-Muslim client, that may not be one of their pieces of how they see the world, right? And sometimes I'll have talked about something like, I'll make a comment with the non-Muslim client, like, you know, life is really short, and they're like, that's really morbid. And you forget, like with non-Muslims, talking about death is really morbid. With us, it's really like uplift. You know, it's like, oh yeah, it gives us greater context and purpose to our life. With non-Muslims, their frame of mind is more like YOLO, like I need to live in the moment. So I'm code switching because I have like both cultures. You see that?
Yeah. So that's okay. And we actually do have a question in the chat too. Do you see that? How do you use ACT or other modalities with Muslims who are using spiritual bypassing as a coping mechanism? For example, denying that they are going through difficulty.
Ooh,
that's a good question.
Well, bypassing. I don't know that I've heard of that. But
so I can explain a bit more what I mean about spiritual bypassing. So like what I mean by that is when clients who are Muslim or just religious in general, where they're completely kind of like, oh no, nothing's going on, it's okay, like God is going to take care of this, but they're not really engaging with how this affects them. So they're not really processing. It's kind of like denial of what's going on.
Okay. Yes. Okay. So this is really hard. I will tell you, for me personally, I'll tell you what we do in ACT, and I'll tell you that it's easy to say and really hard to do. This is a really tough thing, because in order for therapy to be effective, the person has to like show up and do the work. And they're not in a space of readiness to do that if they're not acknowledging the problem, or if they're looking at it solely as like, Allah will take care of it. It's in the will for me to, it's in Allah's will for me to suffer perpetually, like, right? Because like in Islam, we also say like, yes, and tie up your camel, right? So, but by that argument, but in ACT, we use, it can take a lot of time. And so there's two things. So one is creative, it's called creative hopelessness. So we would look at like, okay, tell me everything that you've done that's worked. And maybe like, well, I've prayed, and well, it's not a problem. Okay, it's not a problem for me. So tell me what's going well for you then. Well, you know, and it can't be, well, how does that work? How is it that you're here to see me? There's something that you want or want to be different in your life. And at the same time, you're saying it's working well. Well, but how do both of those make sense? Well, they really don't. But if a client's not ready to explore that, they'll they might shut down and be like, no, it's fine, there's nothing there. And we don't want to argue. We don't want to try to convince them. You can't, convince a person to see that they are, that they need to do something different and change. But you can point out those discrepancies, and you can keep asking them, well, I prayed, did that work for you? Well, I still felt really sad. Okay, so what else did you try? And you go through a string of things that kind of gets them to see that like what you're doing isn't working. But you want to be careful to not argue with them. So sometimes it is down to like, I give several sessions and see like, are you willing to show up or do the work? Or I'll point out what's happening between us. Like every time I've identified like this thought, you kind of really seem to, shut down, or you don't want to go there, what's going on. And so sometimes it's like, they may not be ready to work on things, but it's a thing called an ACT. We try to work with creative hopelessness. Like, let's look at everything you're doing and how it's worked or hasn't worked. So you've prayed and you've said it's all just in Allah's will, right? Like you don't have a role in your life. How's that work? Does it work? How does it not work? Does it help? Okay. Do you still want to be here? Does that kind of answer your question?
Yeah, Jazakallah khair, thank you. Yeah, that really
you're welcome.
Because I was thinking of people who are like really defensive, or they're like, no, it's
It's
like I'm here, but like I'm fine. So like, how do you take that into account with
and I will tell you personally, it is so hard. The other thing they'll do is they'll go, no, I'm fine, you tell me. They think maybe like showing up to see you is going to change their situation, and it's super hard. It's a balance on my end between patience with them and trying to be, because it has to be kind of their readiness. You don't want to force, and then also sometimes being blunt and, and saying like, you're here to see me. And they're like, no, I'm fine. They'll give you a whole justification of why they're fine and they don't have any issues. And I'm like, okay, is that all you want out of life? Because if it's working for you, right, you always have a choice. Even in, like in Islam, we have limited free will, moment to moment. You don't have to be here. You don't have to see me. And if it's not, yes, some of this is going to feel bad. Talking about it, you're going to feel sad, but also what's going to come with the sadness, if you're willing to sit through it and tolerate the distress, you're going to get clarity, and you're going to get some more choices and tools with how you show up in life. But we can't force people, like you can lead a horse to water, but
Right.
people have their own, yeah. Yeah, excellent question.
Thank you. Thank you so much, Dr. Shah. That was very, very relevant to what we're discussing all day today. And this is really helpful information.
I'm
Appreciate
so
any
glad.
more comments? We have a couple minutes left. Actually, we have 1 minute left. So I'll just end by saying, I will end by saying thank you, but also putting up the CME, the continuing medical education credits on the slide and sharing that.
We are sharing our screen, right? Let me share my screen and then we can open that one. Does all of you can see the CME code on the screen?
Yes.
Yeah, okay.
Thank you very much. And as a reminder, all of the presentations from today and yesterday at the conference will be recorded or have been recorded and will be uploaded on the Muslim Mental Health Conference YouTube channel probably in the next week or so. All right. Well, thank you very much, everyone. Thank you, Dr. Shah, for such a great presentation. And those of you who are tuning in, you can actually tune in for the keynote speaker and some more. In track A has some more speakers to kind of round out our day. Thank you.
Sana, really quick,
Yes.
how can people who weren't at the conference, how do they access these recordings? How can we see it?
It will be on our YouTube channel, Muslim Mental Health Conference YouTube channel.
Oh, okay.
So once we are all done, I haven't checked myself, but maybe they are uploading it alongside. But definitely once we are all done by today, everything will be on the YouTube channel.
Oh, wonderful. Thank you.
No problem. Thank you so much.
Okay, thank you, everyone. Have a good evening.
Allah Hafiz. Assalamu alaikum.